Good afternoon and welcome back at ECCMID TV, brought to you live from Pavilion 1 here at the ECCMID Congress Center in Lisbon, Portugal. My name is Judith Cohen. I will be your host at all these ECCMID TV broadcast series that we're presenting from here. And I'm very delighted to introduce you to our next guest here live in the TV studio, who is Dr. Bart Haagmans, and who is a recipient of the Excellence Award in Clinical Microbiology and Infectious Diseases for 2022 this year. Warm welcome to you, Bart.
Thank you so much.
We're happy to have you here. Just to sum up for our viewers, your track record, research-wise. You're a virologist working in the Erasmus Medical Center in Rotterdam in the Netherlands, and you have a research line, if I'm informed correctly, on the pathogenesis of viral infections, and especially those with zoonotic transmission.
Yeah, that's correct.
That's correct.
So, and then also focusing on coronaviruses. So
yes.
Already starting at the veterinary faculty in Utrecht with viruses in animals.
Yeah.
And then moving to Rotterdam, studying coronaviruses in humans. And of course that started in 2003 with SARS, the outbreak.
Yeah.
And then in 2012 there was the MERS outbreak in Middle East, where we studied also the zoonotic transmission. And of course we were heavily involved in the COVID pandemic.
Yeah, and your excellence in your research has been acknowledged because you were awarded this ECCMID with the Excellence Award. Congratulations.
Thank you so much.
On this acknowledgement. You gave a presentation at the award ceremony, and the title was Characterizing SARS-CoV-2.
Yeah.
So this was really with the focus on this coronavirus, the virus that caused the pandemic, an ongoing effort. Do you care to share a little bit more about that? Why is it an ongoing effort in your opinion?
Yeah, I try to broaden it a bit. So I went back to what I said earlier to SARS in 2003, where we already started developing methods to detect these emerging viruses, to develop techniques to develop vaccines, and that was continued with MERS. And those experiences were taken in the outbreak, so that that's an ongoing effort.
Yeah.
And then more going into depth what we're doing right now over the last 2 years, and have an outlook on new developments and what we need in the future. So that was basically what I wanted to present, showing that there's a need also for research to support the diagnostics, interventions and vaccines, not only now, but also in the future. So also for new outbreaks that will occur.
So with the current coronavirus outbreak, you were sort of prepared, I guess, because you already dove deep into the other coronaviruses.
Yes.
How do you feel prepared for any future new pandemics? Is that something you can be prepared for? I mean, we all speak about preparedness.
Yeah, one thing of course is that you are prepared in ideas, but you need to be prepared also in funding.
Yeah.
And so far it has been very difficult. So before the outbreak, we made announcements and we had discussions on there are possibilities that an outbreak will lead to a pandemic. But if it never occurs, people are not really confronted with that. And now people know, okay, this is a real danger.
Yeah, it can
so
really
we have
happen.
to see how also at the level of funding we will be prepared, and there will be initiatives to increase our diagnostic capacity to early detect these viruses, because the earlier you are there and try to contain the outbreak, the better, so you don't have to wait. And of course that we need broad-acting antivirals and vaccines. So we have to transit from the current vaccines for coronaviruses, vaccines that are broader reactive, but also focus on other emerging infections and the threats that are apparent.
Yeah. How do you look back on the COVID-19 outbreak? How fast was the response?
Basically the response was, we did not bad, for sure.
Yeah.
Because based on the information early on from China, we already thought this could be a SARS-like virus. So without knowing that it was a SARS-like virus, already diagnostics were developed.
Yeah.
And these were already in Europe distributed all different labs, so that already in beginning of February, labs were prepared. There were no cases so far. So with that respect, detection of new cases was arranged.
Yeah.
And early on, in the earlier outbreaks and many emerging infections, it's often sufficient because the people develop a severe disease to identify those that are infected and then put them in quarantine and isolation and the contacts in quarantine. And by doing so, mostly you can contain the outbreak. But now it didn't work. So that's what we all know.
Yeah.
So we were, with that respect, I think we were a bit surprised, and we thought, yeah, we can, with the current, and then things become more complicated. And looking back, I mean, I'm really, from the positive side, I would say the vaccines that are developed by, especially the mRNA vaccines, have shown to be effective. And so this was to me, and the speed by which these were developed and then also produced and distributed, I think it's unbelievable if we compare that to efforts that were done earlier on, where it took sometimes 10 years to get a vaccine.
Yeah. Yeah. So what kind of new developments are you looking forward to? Or are you specifically working on new research projects with your own team?
No, yeah,
are you expanding on
this? It's basically on the new techniques and the platforms for intervention strategies that are important. I think also the networks that are now set up for surveillance and detection, that we keep on tracking outbreaks to be early on the ball. I think that's important. But next to that, I think it's also important to focus on basic research, because we further need a more in-depth understanding on actually why do these emerging infections occur, how can we develop novel intervention strategies, because that has been difficult really to develop. Now there are some new antivirals. So I think we have to look at a broader sense and look at other possible threats.
Would you say that you're shifting with your team from a more reactive modus to a more proactive modus?
That's what we want to do, I think, And then also, you need to collaborate with different parties, WHO, ECDC, but also the pharmaceutical industry, and building networks to more rapidly engage these infections.
Yeah. So is the coming together of our first ECCMID on site now, is that helpful in strengthening those networks you need in order to get to preparedness?
So indeed, that's the point. You need, the different disciplines need to come together. That is essential. Especially with an outbreak, you have the labs, the diagnostic labs, you have the clinic, the public health, you need to communicate, you need to do trials, all kind of things. So the complexity is huge, and that we need to deal with also in the future, I think.
Yeah, it's not just research anymore.
It's not research anymore, no.
No, it's
and it needs to go quick.
Yeah.
It needs to be very quick,
Are you looking forward to any other ECCMID scientific program elements specifically?
Yeah, there are specific workshops on which I want to visit, so that's.
Are they also on the coronaviruses, or?
Of course, I have a more focus on COVID and these kind of things, so that's, I'm looking forward to that.
Yeah, well, I think you're going to have a very interesting time. It's an excellent program.
For sure.
Thank you so much for coming here live in our studio.
Thank you.
We will be tuning out again with ECCMID TV, but we will be back on the clock at 2, and we will be inviting as our next guest Professor Robert Reed, who is the moderator of the hugely popular ECCMID Clinical Grand Rounds. So please tune in and let's hear together from him why this is such a popular program element. Hope to see you at 2.